Well, a very good afternoon, everybody. Oh, crikey, it does boom in here, doesn't it? Feels I'm making announcements in a football stadium or something. Warm welcome to members of the Essex Joint Committee here with us. I'll get everyone to introduce themselves in a moment. A warm welcome to members of the public who've joined us here in Harlow and to those who have joined us online. A polite reminder to members of the public here that this is a meeting which is held in public. It's not a public meeting, but we're very pleased that you're here to listen to our deliberations. The meeting will be in two parts. Part one is where we talk about things which are not commercial and in confidence, and in part two, there are things which are commercially confidential. And so at that point, at the end of part one, we ask members of the public to leave us. There'll be a 5-minute pause, and then we go on with the second part of our meeting. Can I please remind colleagues to use the microphones so that those online can hear us and we can hear each other. Hello. I'm Mike Thorne. I'm chair of the Essex Joint Committee, and we'll go around the table from here. Tom.
Thank you, Mike. Good afternoon, everyone. Tom Abel, Chief Executive of the ICB.
Good afternoon, everybody. Giles Thorpe. I'm the Executive Chief Nurse for the ICB.
Afternoon, everyone. Jen Kearton. I'm the ICB Chief Finance Officer.
Good afternoon, everyone. I'm Dr. Anna Davey. I'm the Primary Care Board member for Mid and South Essex.
Afternoon, Mark Harvey, Executive Director for Adults and Communities at Southend City Council.
Good afternoon, Ian Perry, GP and Primary Care Board member for West Essex.
Afternoon, everybody. I'm Janet Wood. I'm a non-executive member at the Suffolk and North East Essex ICB.
Mark Balaam, Associate Non-Executive for Mid and South Essex ICB.
Good afternoon, everybody. Michael Watson. I'm Executive Director for Corporate Services for the ICB.
Hello, everyone. I'm Beverly Flowers. I'm the Executive Director for Neighbourhood Health.
Afternoon. I'm Dr. Matt Sweetin, the Medical Director for the ICB.
And colleagues who are looking after us in the room. Helen.
Good afternoon. I'm Helen Chesney, and I should be taking the minutes for you today.
Thank you. Well, welcome to everybody. We've got the register of interests. I haven't received any particular updates in relation to this part of the agenda. And then we move on to questions from the public. We've had quite a lot of long questions, so I'm going to summarize the questions. And then various people have agreed to give a response because it's in their area of responsibility. So there's a question from Councillor Amy Kirby-Taylor, who asked the Essex Joint Committee of its intentions for recovering the trust of transgender patients and how it will tackle transphobia and what engagement it had with the Pathfinder trial that was cancelled. And Tom, you're going to respond to that.
Yes, thank you, Mike. So clearly, the question didn't relate to anything specifically that's on our agenda today, and so we will respond in detail outside of the board meeting. However, we're clearly committed to ensuring that we won't tolerate discrimination in any form in terms of the way that services are delivered, and this will be an area that we will look at as we move into the new ICB in terms of ensuring equity of access to services for all parts of the communities we serve.
Thank you. Maggie Cleary has a question with reference to the quality report on the agenda, and Ms. Cleary sought clarification on the referral process within the redesigned neurodevelopmental pathway and how the ICB will ensure the new process does not introduce, in her words, further barriers to accessing referrals. And Giles, you're going to respond.
I will, thank you. Transforming pathways for children and adults with neurodevelopmental conditions remains a priority as we stand up as the Essex ICB. And this year, we've already begun work to address workforce capacity. We're redesigning pathways and strengthening support for people with suspected autism spectrum disorder and attention deficit hyperactive disorder. As part of this, we launched 2 frameworks of accredited providers to increase capacity, improve clinical consistency and quality, and support general practitioners in guiding patients beyond diagnosis into appropriate treatment. The agreed referral approach remains that primary care gathers sufficient information to determine clinical appropriateness, and that is in line with NICE guidance, without creating unnecessary administrative burden. We continue to work with practices to ensure triage processes are proportionate, accessible, and make reasonable adjustments for parent carers, including those with the digital reasonable adjustment flag. However, we do recognise that some practices remain unclear about referral requirements, and we are improving communication and support to ensure that new processes are adopted effectively. Alongside this, we acknowledge the impact of long waits highlighted in the SEND inspection and the vital role of the voluntary community sector organisations. Through joint commissioning with neighbouring ICBs, we are embedding the VCSE-led pre- and post-diagnosis support into future pathway redesign and as part of our 26-27 commissioning plans. This will ensure that children, young people and adults can access timely, consistent support in their communities. And we're also working closely with local authorities to ensure that any emerging local government reform proposals strengthen rather than disrupt joint commissioning with the VCSE sector.
Thank you. Peter Blackman asked to give thanks to everyone in Mid and South Essex ICB and the North East and West Alliances for their professional and dedicated public service and for keeping working for the good of patients, service users and public to the end of the present local organisations, because of course the new ICB comes into being on the 1st of April. And Peter wishes all who have or are leaving all the best of the future, and to thank those who will be building and developing the new Essex Integrated Care Board. Peter then sought assurances regarding the effectiveness and efficiency of the primary care networks and integrated neighbourhood teams in South Woodham, Ferrers, Malden and the Dengie, seeking to understand how the level of community would be recognised and served in the new Essex ICB. And Beverly, you're going to respond to that.
I am. So we would like to thank Peter for his kind words and support for the good work undertaken by the staff of Mid and South Essex ICB and the North East and West Essex Alliances, and we have already shared this thanks with staff. The ICB has been working with partners to agree the boundaries for the new neighbourhoods across Essex. There'll be 41 neighbourhoods within Essex. In Malden, we are proposing 2 neighbourhoods, one for the Dengie and the other for Malden, including the areas north of the Dengie. We will be working with PCNs and wider partners to continue to build on the good work of the existing alliances and communities to deliver the national vision for neighbourhood health. In line with the new GP contract, the ICB has no plans to change the makeup and boundaries of primary care networks at this time, unless PCNs themselves are expressing a desire to reconfigure. As a strategic commissioner, the ICB will be working at a multi-neighbourhood level with footprints that will align to the outcomes of the local government review. How we will work with these multi-neighbourhoods and neighbourhoods and how we will develop this work will be developed across the next 12 months in line with the scope, and at the time this was written, of the soon to be published neighbourhood guidance, but the neighbourhood guidance was published late on Tuesday evening. It is therefore not possible at the moment to say how specifically we will engage with specific communities as identified in the question, but it's recognised that we need to ensure that we continue to serve these communities within the new structures.
Thank you. Kerry Norman has posed a number of questions regarding the cancer services provided by East Suffolk and North Essex NHS Foundation Trust in relation to data integrity, patient consent and record keeping, and the independent investigation of concerns and merger due diligence. And Giles, yeah, I think you're going to respond.
Yes, I am, and thank you for the question. It's important to note that improving cancer services across Essex will remain a critical priority. We know that outcomes in our area have been amongst the poorest nationally, and we are fully committed to the significant journey ahead to improve standards for our patients. From the 1st of April, the new Essex ICB will take on the role of Strategic Commissioner, as set out in national guidance, with responsibility for long-term planning, quality oversight, and securing consistently high-quality care. Cancer improvement will sit at the heart of this work. However, for ESNEF specifically, the Norfolk and Suffolk ICB will become the lead commissioner, so detailed concerns about ESNEF's data, governance, or cancer pathway processes should be directed to them. However, as an associate commissioner, we will continue to raise and help address any quality issues relating to services delivered from the Colchester site. In fact, our chair has raised this issue directly with the new chair of ESNEF, Tracy Dowling, for her consideration. NHS England will continue to provide performance oversight, including for cancer standards, under their regional operating model. And Essex ICB will work across the county and use all the levers available to us as a strategic commissioner to drive improvement and respond to concerns affecting our patients.
Thank you. That then moves us on to the minutes of our previous Part 1 meeting. Everyone happy with those? Thank you. And has anyone got any matters arising which are not on the agenda? There's no outstanding actions on the action log. And of course, the purpose of this committee is to make sure everything is set up for D-Day or A-Day, the 1st of April, which is when the new ICB will come into being. And we need to have all sorts of things lined up for that, policies and so on that are required, the various teams coming together, people knowing who's going to be in a role and who's not going to be in a role, and so on and so forth. So there's an awful lot of work been going on, and that also reflects the fact that actually there's quite a few people who haven't been able to join us today because there isn't still an awful lot to be done between now and the 1st of April in order that we do get up and running. So I'm very grateful for everybody for their hard work in doing so. So I then move on to our first substantive item, which is a Lampard inquiry update. Matt.
Thanks, Mike. I just want to state at the start of this that the ICB remains committed to supporting the inquiry within our powers and very much being transparent and supportive. And we will continue to do that as we transition to the Essex ICB. I have 4 points for an update today. First update for the board to be aware is that there has been an extension to the inquiry that you may have seen published. Baroness Lampard has been taking soundings from multiple stakeholders, and it became clear that there were concerns, particularly with individuals and families concerned, that they needed more time for hearings. And so there's been an extension to the inquiry, likely to close in June 27. Previously was October 26, and we should expect some of the recommendations from the inquiry now 2028. So that's just important to know in terms of time frames, but as I say, we remain committed to supporting that. Second point, we have responded formally now to our Rule 9, which the ICB has been requested for. That is a formal request from the inquiry around detailed information around our commissioning, contracts and quality. And I'm very grateful for the team for their hard work in pulling that together and submitting that. And we will continue to support the inquiry in that regard. Thirdly, and just again to reassure, as we transition from 3 ICBs into an Essex ICB, we will ensure and are ensuring that the organisational memory will be there to make sure that we can respond to any future Rule 9 if they come along, but also having continued access to physical and digital records where appropriate, and also having a detailed log of the staff members, so if we need to contact them or support them in any way. Finally, from me, the Essex ICB board will have a detailed report about Lampard in due course, and that will come in a few months. But as I said, we are just in legal negotiations at the moment around confirming statuses and the way forward as a core participant in the inquiry. So that's the verbal update from me. Happy to take any questions.
Any questions or comments? I mean, I understand why it's been extended, but of course it means we won't get the outcomes on which we expected to act for a further extended period of time, but it must run its full and proper course. Okay, thank you very much. So we move now on to our Chief Executive's report, including an update on the proposed Essex ICB governance and transition arrangements. Tom.
Thank you, Mike. So I think the report is fairly self-explanatory. I think just I'll focus particularly on ICB transition and organisational change. So clearly, as you've said, Mike, there's been a lot of work around the preparatory steps to create the new organisation, and slightly later on in the agenda we will be looking to consider the proposed constitution, committee structures and some of the core other documentations to establish the new organisation on the 1st of April. Alongside that, there has been significant work across the 3 ICBs that currently support Essex around ensuring that we have got the necessary arrangements in place around the handover of responsibilities, contracts, etc., to the new organisation, and the procedures in place around the successful and safe closure of the existing ICBs. And that's work that we're doing, across our region, given where we will be moving from 6 ICBs to 3. Alongside that, in terms of our own organisational change process, we've now concluded the first phase of appointments to the new structure, and all Essex-facing staff now are clear in terms of their status. For individuals who have been successful at securing a role, we are working with them to agree their individual transition and handover arrangements. For those who have unfortunately been unsuccessful so far, we will work with them during their notice period to look at any other opportunities, either within the ICB or with other partners regionally as well. And for colleagues who applied and were successful in their voluntary redundancy application, the vast majority of those colleagues will finish their employment at the end of this month. I think I just wanted to put on the record, Mike, my thanks, and I'm sure it's something the board will all agree with, the thanks to all colleagues across all of the ICBs in terms of their continued hard work over the course of the past year. It was the 13th of March, I think the announcement was made last year around the changes to ICBs, and so a big thank you for their professionalism as we've kind of navigated the course of the past year. Alongside that, we have obviously, and I set out with a report, and we discussed in our seminar session earlier today in terms of some of the work that's going on around thinking about the ambition and shape of the new organisation. We've also progressed our kind of planning work as well. We successfully submitted actually a further iteration of our plan this Wednesday to NHS England. I think no significant change in terms of any of the top line kind of finances for the organisation, but we have obviously been working very closely with NHS England about some of the specific challenges that we know we have within Essex around waiting time improvement and waiting time recovery, particularly at Mid and South Essex Foundation Trust. As part of the work and something we discussed, we have agreed an initial stage of work in terms of additional activity through independent sector providers to support our ambition to begin to, start to see more significant reduction in waiting times and waiting lists within the organisation. We've also submitted a working version of our population health improvement plan that boards are aware of. This is something we've been talking through with our health and wellbeing boards over the course of the past week or so, but clearly that's going to be a really important document for us to kind of guide the work and the focus of the board as we move into the new organisation and as we begin to take on our role as a strategic commissioner for the residents of Essex. But I'll leave it there, Mike. Thank you.
Thank you. Any questions or comments for Tom on his report? I mean, I do think that all of the teams connected with the coming together of three different parts of three different ICBs should be commended in the way that they've handled this, because this has meant a reduction in budgets of typically 40%, and that of course is achieved through consequences for individuals and their employment, and the fact that the various boards have not been troubled with a lot of difficult issues from people shows that it has been handled very well, because the board under those circumstances would be the sort of the backstop for things that were not handled well, and it is a tribute to the teams, both Tom and your fellow chief executives who've been handling this, and we should put that on record. It's a very unfortunate thing to have to do, but I think it's been handled as well as could possibly be expected under the circumstances, and as you say, in a time frame that none of us could have imagined. It was during a board meeting like this that we heard last March the 13th that the cuts were to be made. So thank you, Tom, and indeed all the executive team here around the table and in the other ICBs. So we come on then to the quality report and the Giles.
Thank you, Chair. So I will take the report as read and offer some detail around the key highlights. Board members will be cited on now some clarity around priorities, which will be set as part of the National Quality Strategy, not least the development and implementation of the modern service frameworks, and also the implementation of the NHS Experience Excellence Framework. In relation to National Quality Board guidance, I have appended at Appendix 1 an outline of what is expected in relation to quality control, improvement and assurance at an ICB level, and also a schematic in relation to how governance will work. I think to assure the board that system quality groups will remain as a core function of ICBs, and alongside the development of the Commissioning Quality and Resource Committee, this will strengthen the ICB's ability to monitor quality risks, drive improvement, and also hold providers to account through a coherent and transparent governance structure that will align to contractual responsibilities. Specifically in relation to Essex, it's important to note that we have had 2 area send inspections in recent months. The Essex area send inspection report is currently going through factual accuracy process, and the Thurrock send area inspection has been published. You will note the areas of good practice which were noted, but also a key recommendation for health leaders, which is to work at pace to accelerate our existing plans, maximising opportunities for early identification of need and reduce waits for assessment. It is important to note that these were areas of development that the team were already aware of, and the Babies, Children and Young People Commissioning team is working closely with not only Thurrock Local Authority but all local authorities to ensure that the health recommendations from previous reports and these are acted upon, so that we have a robust implementation programme in place, so that we are able to better meet the needs of children with vulnerability and complexity. You'll also note that the schools wide paper has been published and an expectation around local area send reform plans. I'm pleased to note that the Southend, Essex and Thurrock planning meeting with colleagues from the Department for Education and NHS England took place. It was a positive meeting, and we are confident that we will be able to progress our local maturity assessment and also our local area action plan, which will be signed off in line with statutory bodies governance processes in June, as expected by both DHSC and DFE. To note to the board around the decision being made by NHS England around St Andrews Healthcare on the Northampton site, all relevant integrated care boards were noted that alternate provision needed to be found for the number of patients who are currently receiving inpatient care. So this is enforcement action that has been taken against the provider. You will note that there are 3 patients within the Essex system that have been identified, and we are in the process of finding alternate provision for those individuals. In relation to the Essex site, it's important to note that the CQTC did publish their site inspection, which was rated as good. However, we have ensured that we are moving with a joint quality assurance visit to ensure that any emerging risks in relation to the Essex site that could align to the Northampton site are addressed early, and we will work in partnership with the provider, recognising that this is an independent sector provider that remains under the responsibility of the ICB for quality assurance and oversight at the current time. Happy to take any questions, Chair. Thank you.
Thank you. Mark, was it your colleague who was involved with the schools planning meeting?
In terms of Michael Marks, yes,
Yeah.
I think it was, yes.
Yeah, it was. Yeah. Anything to add?
Not a conversation I've had with him directly, no, so
No,
nothing to add on to that, sorry.
Okay, thank you. Any questions or comments then? There. Thank you very much indeed. We asked a note and we note those, and then we come on to the finance and performance report. Jen.
Thank you, Chair. So just a verbal update from myself today as we acknowledge that the current financial positions of the 6 ICBs remain in their statutory purview until the 1st of April, when we become the 3 ICBs across the east of England. But just to confirm to the board that the 3 component parts of Essex ICB, as will be, are not flagging any challenges to delivering their financial plans at the end of this financial year. So less than 2 weeks' time now, all are on track to deliver plans. So as we move into the Essex position, that's a good position for us to be in moving forward.
Thank you. I mean, I'm aware that each of these items is we're seeing the tip of an iceberg of work, which is sort of hidden below. And in finance in particular, it's been enormous hard work to have the house in order, ready for the transition, and to deal with ongoing problems where we've had to cope with some areas of activity not being able to work within their budget. So thanks again to Jen, to you and your teams for holding on to that. Any questions for Jen on finances at this stage? Okay, thank you very much. We then come on to neighbourhood report. And that's you, Beverly.
Thank you. I'll take the bulk of the report as read and just to pick up a couple of issues. I think one, it's worth noting that we're really pleased the new primary care contract has been issued, although a lot of the associated detail in terms of what some of those things will mean for primary care is still awaited. What's particularly pleasing to see in there is confirmation that the approach that we've been taking as an ICB to date is supported by the contract change in terms of with the development of neighbourhood health and the development of neighbourhoods. We've been saying that we would not be forcing PCN change, and we will continue to support PCNs to remain in the forms that they are currently, unless there is a kind of wish from the PCNs themselves to restructure and change. And we have approved at Primary Care Committee recently a couple of changes within North East Essex to start from the 1st of April to allow them to begin to align in a way to support new ways of working and to reflect some local changes. You'll notice there's an update in the report on the holidays, and I'd hoped to be able today to confirm the exact date of reopening, but we're still waiting on some testing results to come back, but everything is on track for the holidays to reopen back on site, but with a new name. But the practice will be back up and operational. We can also confirm that we've completed all of our due diligence across all areas of primary care to support the transition to the new ICB, which is really important. And a bit like the thanks Mike expressed earlier, I'd like to express my thanks to the team that have done that. It's a massive piece of work to complete the due diligence to support the primary care contract transfer. And we have a clear understanding of the issues and challenges across the 3 ICBs and the actions that are being taken for the new organisation, which is good. Rather than go into the detail on the alliance part of the paper, I was just going to report that since writing it, the neighbourhood health guidance has come out. It came out on Tuesday of this week. There is nothing in there that I think we were not already expecting. I think there's some very clear messages in there around this approach is about returning power to people and is about how we all come together to deliver services locally. There is some sorry, that wasn't me that made the dog bark. It clarifies the kind of role going forward of the health and wellbeing boards and how they become part of that process. It encourages us to continue to work together in partnership with a wide range of partners, and that neighbourhoods themselves will not just be about the realignment of NHS services, but how do we bring together health and care services, the voluntary sector, on what is termed civic society with a kind of wider approach. It's worth noting that there are 3 types of contracts outlined in the document, and that there'll be some further consultation on those, which I think we would welcome. And I think it'll be a really good opportunity for us to think about it as an ICB, but also to encourage our partners, primary care and the wider sector, to think about what that means and what would work. And there will be some further consultation on what they're calling system archetypes, which I thought was a made-up word until I looked it up in the dictionary, which is about how, as we develop neighbourhoods, what it means, how they work together, how we develop a common understanding, and whether they become kind of legal entities in their own right, or whether they become a way of how we work together with a lead organisation, perhaps holding some of the financial risk and the contracting. And I think that'll be a really important consideration. There's some really good work across all 3 ICBs around what could work, how that could work and what it would look like. So I think we need to pick up our practice and think about how we can contribute to that process. Happy to take any questions.
Thank you. I mean, that's good to hear. And I'm pleased that a word was found for you to struggle with, because the rest of us struggle with these NHS acronyms to the extent that I've got an app on my phone which explains many of them. But not
to be extended in the new world. There are lots of new ones.
Lots more to come, yes. Just on the Hollies, I mean, I do think it's a bit disappointing that these tests are ongoing, and I'm a bit anxious that we'll be sitting around this table in a month's time and it still hasn't been filled. I can't understand the reason for delay. My son moved, decided that they wanted to move into a rented property on a Monday, and they were told they could move in on the Friday, and there's about 14 tests, Legionnaires, you name it, that have to be done. This was all done. We do have to put some firepower behind this, because it's just going on and on and on, and we need to offer a body language of get this sorted, please, so that we can re-establish this service. Can we do that, Tom, please?
Yes. Yeah, me and Beverly were talking about it yesterday.
Okay, it just can't keep going on like this. Okay, thank you. Other questions or comments? Anna?
Thanks, Mike. Thank you, Beverly. I just thought I'd reflect a little bit on some of the conversations I was having yesterday at the Health and Wellbeing Board, which was really about the direction of the integrated neighbourhood teams and part of the neighbourhood health programme going forward, and how we really need to change our focus much more towards prevention of illness. So there was a conversation yesterday about, what the NHS means about prevention and what everyone else thinks about prevention, which I didn't actually recognise, because they were saying the NHS thinks of prevention as keeping people out of hospital. But as a GP, I think prevention is very much preventing ill health. So looking at lifestyle, looking at housing, looking at employment, the wider determinants of health. So I think I share that with maybe public health, social care, looking at the broader prevention agenda and how actually we need to move away from the focus on avoiding hospital admissions, as important as that might be, but actually start having very real conversations about health creation. That was what we heard yesterday, health creation, which is a new one. Thank you.
I wonder how you create health, but but I mean,
the latest buzzword.
I understood fundamentally the point that was being made, but I think we're all involved and have been around this table or its predecessor tables in a lot more genuine health ill health prevention and also helping people to keep healthy as long as possible, all sorts of initiatives in your own bailiwick, as I remember, with sort of dieting advice for patients and things who are at risk of being diabetic or were pre-diabetic and things. There's a raft of such things that we've been involved in, and we should be proud of those, but it's never going to be enough with the figures we've got of the differences between life expectancy, the differences between healthy life expectancy in different parts of our patch, and it's probably even worse in the new patch for the new wider Essex ICB, and so on, and with the levels of childhood obesity in the population and in the population generally. So we have to redouble our efforts, because the task is to minimise the number of people who need to be looked after by the NHS, because the money isn't increasing at the rate of the demand for people needing help. So that's why it is so important. But I think, as I was saying yesterday, this is a once-in-a-lifetime opportunity where now the government seems to really have grasped this issue and licensed us with the new structures and with the strategic commissioning idea, licensed us to do things that can really make a big difference in the space, rather than it being at the margins, perhaps, which is where it was. And I think maybe that was a bit behind the point that was being made. But you offered a spirited defence, Anna. Thank you. Yes, please, Mark.
Thank you. Just a comment, I suppose, and to recognise that, and I agree. I think first thing, just I suppose some thanks and all the work that's been happening before we get to this point about we've got two worlds changing quite a lot rapidly. You've got there a little bit ahead of us. It's good to see the Labour plan. I think there is something about remembering, probably not on the prevention bit, use of terminology, us all using the same word meaning something different. And I think there is sometimes we need to embrace the opportunity and have an open conversation about what do you actually mean around that. Because I think actually there is so much opportunity. I think the setup you've got in the ICB and the promotion of that, how we fit that with new governance structures, neighbourhood area committees, which have got slightly different rules, but actually we could look at where do they merge, how do we do that in delegation. So I think we're in a world of opportunity. I think shaping that pre-LGR for us, whatever the outcome of that is, aligning to what your thinking is, which is the conversations we're having, is very positive. So I just want to pass on thanks for that. And actually I think there is an opportunity to do a lot more of this at pace and better together.
And Mark, you've been a champion of that particular cause, and Rob is not here, but so thank you for that, and I'm delighted that you'll be continuing to champion the cause as the new Essex-wide ICB comes into place, because this is about getting the best value for money out of the taxpayer's buck, isn't it, by combining and working together wherever we can. So thank you for championing the cause. Matt.
Quick one for Beverly, actually. Beverly, you mentioned in the paper around the Better Care Fund, and with the publication of neighbourhood health, I guess it's the opportunities that we have with the, I guess, reform of Better Care Fund. You know, I'm thinking frailty and thinking about how we can utilise that totality of resource to really change the way. So I guess that's a work in progress, isn't it?
So yeah, it's quite odd sharing a microphone and having a question. So yeah, I think we've had the guidance now on the changes to Better Care Fund for next year. There's been a lot of work done across the 3 Better Care Funds in Essex this year around understanding how money is spent, understanding and evaluating a number of schemes that have been around for a while that needed to come to, it'd come to a natural end. And also thinking about how do we make sure we've got a pot of money that we can use in a bit of a different way. I think we'll need to bring something back to the board early next year to say, this is where we've got to, this is what it looks like. But I think the Better Care Fund will continue to evolve over the next couple of years. There's something really key for me about how do we make sure that we as a board, and actually the NHS and the local authority, are really clear on what the Better Care Fund is already spent on. We spend it on some things that people don't realise, particularly to support hospital discharge. So there's something about how we also re-educate ourselves to understand how we already spend what's there, as well as taking the kind of advantage of what the future opportunities might be.
Yeah, it's a good point, isn't it? I mean, we need to give stability where it's necessary so that we don't cause problems for the people that we're here to look after while we put our thinking caps on. If things have come to a natural end, that's good, and that's the end of it anyway, and that we could see that was coming. And then your point, absolutely bang on, which is, are we doing things by careful, reasoned intent, or because we've got into the habit of doing that way? And it's good that they're going to be challenged. So thank you. Any other questions? Yes, Mark.
I mean, one challenge historically has been, because it's been annual budgets, prevention, you never get payback in year one. It's always a multi-year payback. With the changes, do we think we will have more opportunity to actually take a longer term view of investing in something which will pay back over a number of years, rather than having that immediate turnaround?
Yes, Mark. So I think we will in some instances, but we do have to remember that some of the prevention initiatives we put in are even beyond the generous 3-year revenue allocation that we've got settlement now. So we're talking almost 10 years, 15 years before we see the impact of some of this. So some of it is going to be about being brave and having that confidence and faith. But I think there's also something about how we evaluate that's been in place previously. So actually we can see if it has turned the curve, so we can start to build that evidence base for making decisions as we move forward.
Yeah, I mean, that was a discussion point at a meeting yesterday about when would you know, if there is a 15-year difference between one part of the patch, the expectation of people there, how much of their lives they will live in a healthy condition without any long-term conditions. If there's a 15-year gap, how long will it take to change that? Well, isn't the obvious answer at least 15 years? You see what I mean? It must be, mustn't it, mathematically? So that's why we have to look for other things if we want to demonstrate the impact we're having, because and no one is going to take us seriously if we say we're going to try and solve this over 15 years. We have to be doing things. Any other questions, comments on this paper? Thank you very much. Then I move on now to items of general governance. First of all, the board assurance framework, and that's you, Tom.
Yes, thank you, Mike. So you've got the board assurance framework in front of you. In terms of the risks haven't kind of significantly changed in terms of the strategic risks. So remain workforce, primary care estates, quality assurance of service, access services, system financial performance, and ICB transition. Clearly, this is probably the last kind of version of this sort of like ICS style BAF. And so as we move into the new year, we'll be updating this to reflect kind of ICB specific risks in our new role. So I think that will help in terms of guiding the conversations and discussions of the board. I don't think there's anything I particularly wanted to highlight. I think they're all matters that board members are well aware of and the actions that are being taken. But I'll have to take any questions.
Yes, thank you. Any questions or comments? If not, we've received that update. Thank you. The minutes of these are already approved minutes of Essex Joint Subcommittees. Does anybody want to bring out anything from those? They've been discussed and agreed. Some of you were at some of them and so on. Anyone want to bring out anything in those? I think it's all work in progress. If not, thank you. So now we come on to the item of proposed Essex ICB governance. And these are a lot of very detailed, crucial pieces of paperwork for the functioning of the new ICB, which are a legal requirement to be there. And I should be very grateful if there's anybody around the table who can find more mistakes in them than I've already found, because then it won't feel personal, Michael, that I'm out to get you or the authors of these papers in any way as I've been through them. I think they've been very thoroughly put together. Seriously, I didn't find that many things within them, but it would be wonderful if somebody else did find something to show that they've got an eagle eye too. But Michael.
Thank you. So in terms of the constitution, if I take it in stages, in terms of the constitution and standing orders, those have been before the committee previously, and have, just to remind the committee of the process, we have to have our, as an ICB in statute, have to have our constitution approved by NHS England. In practice, that means that we have to keep our constitution quite close to the NHSE model constitution and have variations agreed by them. So the constitution and the standing orders have been to NHS England for approval, having been to this committee previously. NHS England have approved them, I'm pleased to say, so they are coming today for kind of final approval so that they can be adopted by the Essex ICB on the 1st of April. In terms of then the second element of the paper, which is the approval, or the thing that we're requesting, which is the approval of the functions and decisions map and the standing financial instructions, you will be pleased to know I'm not planning to go through them, but would be grateful for any comments, particularly if people have picked up things that we need to change. I did think it was worth saying, though, just as a reminder to the committee, following on from the conversation we had back in January in the board seminar session on some of the principles by which we are trying to develop those functions and decision maps and approaches that are set out for it today. So just a reminder, we're doing our best to align to the new ICB blueprint where we can. Well, it's not so new anymore, but the model ICB blueprint from last year where we can, recognising that there has been developments in policy and approach since then. We are trying to streamline decision making and make it as simple, clear as possible, removing duplication and delegating decision making wherever it's possible to do so, and ensure that it's aligned to strategic and operational planning. The decision maps and committee structures, etc., that are before you today are the right governance for the start of the ICB in April, but we also need to recognise that they will need to evolve over time, as not only because the ICB's ways of working and responsibilities will no doubt evolve, but also as the world around us evolves with the various changes that are happening in local government and elsewhere. So they're ready for the April the 1st, but we do need to recognise that we will need to keep them under review. So we're asking for the committee's approval for those. And then finally, it has, first of all, just to say, it has been a huge amount of work to prepare to get the governance right for the launch of the ICB in April. So I just want to say thank you both to the governance team in MSC for the work, MSC ICB for the work that they've done, but also colleagues in Herts and West Essex and Suffolk and North East Essex who have also been helping to align governance across what will be the new ICB. There is the possibility that things will emerge between now and April the 1st that we need to kind of close off and make sure the committee are happy with before we go through to April the 1st, which is why we just have put that additional recommendation in about the potential for kind of virtual approval if needed. So we're seeking approval for all of the things that are listed in the paper, but as I said, some of them you will have seen previously.
Thank you. And I mean, how these have been put together is the very definition of enthusiastic plagiarism, isn't it? Because we've stolen the best from all three ICBs to come up with this new version, all of which originally had to conform to a basic template, but we've still stolen the best we could find. People happy to approve the Constitution Committee structure and standing financial instructions? Thank you. And happy to approve standards of business conduct policy and update on policy development? Approved. Thank you very much indeed. We will need I think, to at least have in the diary the possibility of an informal online meeting, just in case there's anything, papers that we haven't got in line for the 1st of April. And that is likely to be, just as I say, an informal gathering on the 26th of March. We'll be in touch with people about that in due course, just in case. Thank you. So that brings us on to the effectiveness of the meeting. I think people from, the Joint Committee members outside of the executive, are you happy that we're getting the business done and that we're, marching towards where we need to march? Janet, yes?
Yeah, I think done an excellent job of preparing for the new Essex ICB, and wish you all the very best.
Thank you. Ian? Okay, thank you. Mark, you happy? Thank you. Good. And the other Mark?
Yes, definitely.
Okay, thank you very much. So there's no other business that I've been notified of. So at this point, we say goodbye to people who've joined us online. Thank you. And thank you to those who've joined us today here in person. We're now going to move to part 2 of our meeting, which are confidential commercial items. So if people could please leave us, there'll just be a 5-minute pause whilst that happens. Thank you, everybody.